Hello and welcome to the Oakland County Megacast. I'm Tyler Keefe alongside Ronnie Dahl in the studios of Civic Center TV and 89.3 Lakes FM, our flagship studios here on the Megacast family of TV, radio, and other media outlets. Today, as always, we're also joined on Comcast Channel 15 and AT&T Channel 99 by Birmingham Area Municipal Access. In addition, we are online, Civic Center TV, and on the Facebook page of the Orchard Mall, civiccentertv.com and facebook.com/Orchard Mall. Today, of course, we are normally on 88.1 WBFH, the Biff, but unfortunately they're having some technical issues over there that they are working out today and will not be joining us on today's program. But you can learn more about the Biff on our website, civiccentertv.com/megacast, and learn more about all the broadcasts that they do, including broadcasts of Bloomfield Hills Blackhawk basketball, which they'll be broadcasting later on tonight when they take care of those technical issues. Joining me, as always, in the studio here at Green Media Center on Walnut Lake Road in West Bloomfield, here is Ronnie Dahl.
Tyler, happy last day of winter.
Yes, last day of winter. It's finally over. We've done it. We're here. Hopefully the warm weather is too.
Oh, I will tell you, it was windy yesterday. Did you go outside at all?
Unfortunately, not till I didn't. Unfortunately, I did later on as I was leaving the building, and I walked outside and I immediately got swooped into the swamp area off between us and Town Hall. It was so windy. But no, I was hearing that wind all throughout the day. Jake and I are in the front office of the building doing our normal daily work for the Megacast and other productions here at Civic Center TV, and the whole day I'm just hearing whooshing sounds from outside the window, and it was aggressive. It was very, very windy yesterday.
Well, hopefully the front has moved through.
Yeah.
It's the last day of winter, and I believe nicer weather is on the way for the weekend at least. But today we are going to have a lot of sunshine.
Yeah, it's going to be a nice sunny day today. Those warmer temperatures are going to slowly but surely start filing in, and we're going to say goodbye to the winter weather, hopefully. I mean, Michigan always throws a little bit of a curveball once or twice as we're entering spring, but we're there, and it's going away at some point.
You know where the sun is not shining today, though?
No.
East Lansing.
Yeah,
There is a cloud of sadness hanging over MSU today.
Yeah, that was an embarrassment. I mean, you have an 11-point lead going into the half. You come back in the second half and get destroyed, and then go into overtime and drop the ball. Not the best showing for the Spartans in what was, but that kind of classifies the entire season. It's kind of indicative of how they've played the entire year. It's been a tough year, but on top of that, they just haven't played very well. And the better team won. So congratulations to UCLA, as they'll be the 11th seed, getting one of the final 4 spots in the field of 64, which begins today.
So, hey, the governor just held her press conference. I know that you guys are running around getting ready for the show, but I sat out in the car and listened to it. So some big news that kind of came out of it. One, we had heard rumblings that she was going to lift those very strict capacity limits for some of the stadiums. So now up to 8,200 fans are going to be allowed at Tigers games, which, for before it was only 1,000. And opening day is coming up. That is a national holiday here in the city of Detroit. But also she did talk a lot about youth sports and how COVID-19 right now is spreading throughout some of these sporting organizations. So they're kind of cracking down on stricter testing requirements for some of these athletes. But we'll get into that a lot more with our first guest. We'll have Dave Boucher on with us around 10:20. He, of course, is the government and politics reporter for the Detroit Free Press, because I believe he had to sit in on that press conference.
Yeah, he did, and we'll have him on later on to talk more about that, talk more about what we heard yesterday from the governor and her team over at Ford Field, and go from there. It should be an interesting day.
So as one of the things that did come out today too, starting Monday, people 50 and above are going to be allowed to start signing up for the vaccination. Keep in mind, just because you're eligible doesn't necessarily mean you'll be getting an appointment anytime soon. There is kind of still that waiting period, that lag behind as they try to get the supply to meet the demand. But in the meantime, we are starting to see spikes here of COVID-19. Dr. Jonay Khaldun talked about that in the press conference, but you know what that means? Some of our schools are already feeling the impact. Walled Lake Consolidated Schools officials informed parents Wednesday that due to rising COVID-19 cases, it is forcing them to close Keith Elementary School here in West Bloomfield until at least April 5th. So 25% of the students and staff has either tested positive for COVID-19 or is considered a close contact to someone who has tested positive for COVID-19. And so based on their protocols, short-term closure had to be implemented there at the school. So that means students are going to be shifting to all virtual learning for the rest of this week. All of next week, that third week, they were going to be on spring break. So the district's COVID-19 dashboard indicates that 9 elementary school students are positive, as are 4 middle schoolers and 11 high school students. Another 200 district students are in quarantine after potentially being in close contact with a positive case, as are 15 staff members. We went through this already once before, as some of these schools are starting to reopen. How do they kind of contain these numbers so that we can keep the kids in school? Because Tyler, I'm sitting here thinking about some of these parents. You're anticipating, you've rebuilt your schedule around, getting your kid to school and out of school because, it's a hybrid method and this, that, and the other. And then all of a sudden you get late notice that starting the next day, you're going to be closed down.
Yeah, it's an interesting situation that's going on in these schools because they are slowly but surely getting to have more people coming in for in-person learning. But on top of that, there's still going to be these outbreaks. And as we have the variants going through the state of Michigan, and that's becoming a growing concern, people are going to become even more concerned with that in schools. And these minor outbreaks can become situations where they will close a school down just to prevent massive spread and have to take that step back and isolate those steps back into certain situations instead of district-wide.
So this comes at the same time there is pressure on the CDC to relook at some of these guidelines because right now, remember, it's still 6 feet apart. Well, the Centers for Disease Control and Prevention is looking into whether 6 feet of distance is necessary to keep students safe at school or if 3 feet will be enough because the debate carries major implications for school reopenings. The current CDC guidance recommends maintaining 6 feet of distance between students, severely limiting the number of people who can safely fit into each classroom. We've talked about this with some of our superintendents and principals in the past. These school buildings were not designed to be 6 feet apart. So one recent study did show that lower physical distancing policies can be adopted in school settings with masking mandates without the negative impact of student or staff being infected. But there are some additional studies that are pending right now. The CDC expects to update its guidance on physical distancing in schools. Keep in mind, though, it all centers around the mask mandate. And while people, we know that these mask mandates are in place, it's implementing them 100% of the time and following that guidance. And we know it can be hard to keep that mask on the entire time.
Yeah, it can, but we have also heard from a number of schools, whether it be their superintendents, whether it be teachers, and so on, the principals, that kids have been very good at following these mask mandates. So that provides some good news for these schools as they continue to plan to go back, and maybe something positive for the CDC they'll be looking at as they modify their guidelines for COVID-19 in schools going forward, and maybe they'll be able to reduce that distance because there's some reliability there among the student body to not only keep the distance, but wear their masks effectively throughout the day.
Another good news here in the state of Michigan, the vaccine is going to be arriving soon at some CVS stores here in our state. CVS pharmacies in Detroit, Fraser, Holt, Jackson, and Lansing will start administering the COVID-19 vaccine as early as Sunday. The doses are going to be shipped to the CVS locations from the Federal Retail Pharmacy Program. It's going to be in addition to Michigan's regular allotment of doses. So the shots may become available at CVS stores in more Michigan communities as the supply of vaccine increases. The vaccinations will initially be available in at least 8 CVS stores statewide, including 5 here in the Metro Detroit area. CVS, though, right now, not announcing the addresses because these could change depending on the supply of the vaccine. They are going to administer the vaccinations to residents who meet the state eligibility criteria, as well as K through 12 teachers and staff and child care workers. Appointments are going to become available starting today, so you can book them starting today. Patients need to register in advance through CVS.com or through the CVS Pharmacy app. People without online access can contact a CVS customer service. Walk-in vaccinations, though, without an appointment are not going to be accommodated. However, I have heard of people being able to get vaccinated by going to some of these stores like certain Myers and some of the other pharmacies, like at the end of the day, the end of the pharmacy shift. If they've had people that didn't show up, they would go over the loudspeaker and say, hey, we have some available. If you're in the store and you want one, come get it.
Yeah, I've heard a few of those stories from acquaintances and from other people and what they've heard, and we've had some of those instances. So I wouldn't be surprised if they do take some walk-ins, but people shouldn't expect that. This, like every other location, is going to be a situation where you have to register, you have to be getting in their line, and they will contact you to schedule an appointment. That being said, it's another place that people can sign up to potentially get the vaccine and put you in as many lines as possible to get as many people through the process as quickly as can be done and keep Michigan's vaccination process and the U.S.'s vaccination effort as efficient as it can be.
Well, I think pretty soon this is going to be like the flu shot.
Yeah.
You're going to be able to get it pretty much everywhere. I do know people that registered for the Ford Field vaccination, mass vaccination clinic that's going to be starting next week, and they've all already been able to get their appointments within the next few days. So that seems to be going smoothly. We'll see once they actually get there and start to roll it out. But so far, I believe they registered over 65,000 people in like the first day.
Yeah, they're getting a lot of people that are going to be vaccinated here, and at the same situation in Ford Field or at other public places like Meyer. These vaccinations are going to be in mass very soon, and it's going to be something where that's probably why you have the state saying April 5th is where you're going to open up to general eligibility for people, because we're getting so many through the lines right now, and these new locations are still doing their own prioritizing in order to get those at-risk populations and populations in need through the lines as quickly as possible before other generally healthy people.
I will say, though, I was looking at, because I'm from Ohio, and so I have a lot of Facebook friends that are in Ohio, and one thing with Ohio, they're ahead of us. So starting March 29th, Ohio is opening up the eligibility to all Ohioans 16 and older. So they seem to be a little bit further ahead than what we are right now, as far as who, like a week or two ahead when it comes to trying to vaccinate more people.
Yeah, and that also can depend on how many facilities they were using, how they were distributing the vaccine, and other factors that come into play as well that determine how quickly they've been getting it out to the population. Michigan's been very methodical, let's say, with how they've put out the vaccines, a lot of prioritizations in certain groups at certain times, and there's been a lot of delays, whereas Ohio, like some other states, seems to have been a little more open from the onset with their vaccination effort, and that may put them ahead. That being said, maybe they're just doing things quicker and a little more efficient, and their processes might be better than those that we have here in Michigan.
Yeah, because starting on the 19th, residents in Ohio 40 and up can get the vaccination. I do know people from here in the state of Michigan, they haven't been able to get it, so they've been going over the border to get it in Ohio. We are so close. We know that's going to happen. One thing Ohio is saying that they are concerned about is the number of cases of the variants that we have here in Michigan compared to Ohio, because while we have state lines, we know people continue to travel across those state lines. And from what I'm seeing on Facebook, it seems like everyone and their mother and their brother is on vacation in Florida right now.
Yeah, and that was a concern earlier on in the pandemic too, especially in the early parts where people were traveling to Florida, to other places on spring break, and bringing the virus potentially back to their home states. And so it's a valid concern for Ohio to have. As my camera has shifted downward, it has a mind of its own, so I apologize for those who just immediately saw my torso and then the table. I digress.
What?
Sometimes these cameras, because they are remote control, just get a mind of their own and start panning left and right or down. And so I just looked at the screen and saw the camera was on the mixer. Anyway, travel has been a concern for a lot of these states that are doing pretty well. It was a concern earlier on in the pandemic, and with Michigan's variant problem right now, it's a valid concern that Ohio has, that Michiganders going into the state for various services, including maybe even vaccine, could be potentially bringing the variant into Ohio. And with it being more contagious, that makes it even more concerning. And unlike on the federal level, these states are not shutting down their border lines and saying, if you're from this state or this state, you're not coming in. We saw that earlier on in the pandemic, states like New York issuing a 14-day quarantine period for people coming in. If the variant problem in Michigan gets any more serious, maybe that's something Ohio considers, but it's very unlikely that would be something that would be considered. Most states haven't done that in this pandemic.
Now, we have, I do remember back in the beginning, though, crossing from the border from Ohio to Michigan, it was a no-no unless you quarantine for 2 weeks each time. And I do know that now even they're saying you should still be tested. Anytime you leave the state and come back, you should still be tested as well. It's really going to be interesting as we continue this conversation as we move into the second phase. So much is going to be around the vaccination. They were saying today, Dr. Jonay Caldoun, I don't know if you were able to listen into the press conference at all. One of their big concerns, not enough people getting vaccinated, because we need at least 70% of the population here in the state of Michigan to be vaccinated to reach that herd immunity that we keep hearing so much about. And when we look at the studies, there's still a pretty large portion of people out there who aren't comfortable getting vaccinated. So if we don't reach that herd immunity, COVID-19 could be with us a little bit longer.
Yeah, that's a very big concern, and that's why even with the vaccinations being more open to more people and us having that momentum can come to a standstill in the higher percentages if we don't continue the education campaign and the community education campaign to try to inspire our neighbors and our friends and others that may be apprehensive about getting the vaccine of the safety that the vaccine has had declared upon it by the scientific community. And education, just as much as getting shots in arms, is a very big key to coming out of this pandemic, because there are still a lot of people that don't believe that the vaccines are safe, or simply don't want to get a vaccine that is still in its infancy.
Did you see the story? There was the business owner of a restaurant on the western part of the state in Holland. She owned a restaurant, and she refused to close down. And she was basically saying, come arrest me. Well, guess what? This morning, Michigan State police troopers went to her business, and they hauled her away in handcuffs. And this is one way that, our elected leaders are really kind of going after some of these businesses that are thumbing their nose at these public health orders. We saw it with Coney Island. Lafayette, Coney Island getting fined $1,000 after the video was posted on Barstool Sports when he went in and tested the Coney dog, and it was before we were allowed to be open for indoor dining by like a few days. He took a bite out of the hot dog. They got fined $1,000 for that.
Yeah, I saw that video, and I heard that story, and it's it's one of those situations where, as we had talked about previously with one of our more recent guests, some of the agencies, particularly MIOSHA, have been really great with education and have focused on educating those businesses that maybe aren't following the guidelines as best or are violating the rules and saying, okay, you're in violation, but this is what you need to do to bring yourself more into compliance, because there is so much confusion between MIOSHA rules versus MDHHS rules versus local county rules. But in cases where there are just blatant violations, and in this case, you literally ask to be punished for it if they're going to punish you, the state's going to take that seriously, because it's made clear to them that this business owner simply does not care to follow those guidelines that are in place, those requirements that are in place, as detrimental as they can be at times to these businesses.
So it was the owner of Marlena's Bistro and Pizzeria in Holland. She operated the business after her license was suspended because of some of these issues surrounding COVID-19. I will say I do know of several businesses that have remained open throughout this entire process. Basically, they were operating speakeasies because at the end of the day, they had to pay. You know, they still had to make their mortgage payments and the rent payments and their electric bills and this, that, and the other. And so for them, some of them were operating, you know, behind closed doors, you know, kind of that secret knock from back in the day to be able to gain access to get in.
Yeah, I mean, for some of these businesses, they don't want to be a burden to the public health, but they're thinking about the longevity of their business and being able to pay their employees, and so they were willing to take that risk, as dangerous as it potentially could have been to a lot of people, or may have been to a lot of people. They were willing to take that risk and say, you know what, we may get fined, we may get shut down, but if we remain closed because of these regulations, or in partial operation because of these regulations in place, we may remain closed anyway. It's a damned if you do, damned if you don't situation. And so some businesses were willing to take that risk, others were more willing to follow the guidelines and provide a safe environment 100% of the way through to prevent the spread of COVID-19.
I will say, so they're saying that one customer may have been potentially exposed to COVID-19 from her restaurant. They did receive, you know, they got COVID a few days after eating there, but how do you actually know where that person got it? That's the hardest thing. It could have been the grocery store. It could have been, you know, anywhere, really. So that's what makes it hard when you're going to prove. This is going to be a very interesting case, though, to watch through the court system.
Yes.
And how the legal system handles this. So we'll continue to keep an eye on that, because the outcome could have a big impact on so many of the businesses throughout the entire state of Michigan. We know there are several other lawsuits going on as well. So we'll see how those play out. We're going to take a quick break here on the Megacast, and then when we come back, Dave Boucher will be with us here on the show. This is the Oakland County Megacast.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask. Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
You know we'll get back to normal.
We'll get back to normal.
We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local. Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together. Together.
Together.
Together. Together.
For the latest information, visit oakgov.com/COVID.
Michigan, the coronavirus pandemic has put us all to the test. And now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
Great to have you with us here on the Friday edition of the Megacast. I'm Ronnie Dahl here in the studios along Mr. Tyler Keefe. We made it to Friday.
Yes, we did. Exciting day. We're at Friday, and a nice weekend ahead of us.
It's a Friday, the last day of winter, and the governor just announced more people will be allowed to attend opening day for the Detroit Tigers. With us now to talk about all things politics, let's bring in Dave Boucher. He's the government and politics reporter for the Detroit Free Press. Always great having you with us.
Hi, thanks for having me.
It's been a busy year.
It never ends. Never ends. It's good job security for me. I can't complain.
And with that, you were in on the governor's press conference this morning?
Yeah, that's right.
I listened to it on the radio. Do you want to give us some highlights of the press conference, but more importantly, did she take any questions at the end?
Yeah, she took a ton of questions today, actually. But the highlights, it's interesting. On one hand, we're hearing about, as you mentioned, easing capacity restrictions at places like Comerica Park. So large outdoor venues can now seat up to 20% of however many people they're allowed to have. Before, the capacity limit was around 1,000 people. So at Comerica, they can have roughly 8,200 fans now as opposed to 1,000 people, which is, a pretty substantial difference. But at the same time, all of Michigan's COVID trends, all of their metrics are going in the wrong direction. Case rates are up. Michigan has the 7th highest case rate per 100,000 people in the country in the last week. Deaths have roughly plateaued after they had been dropping for a long time. Hospitalizations are back up. And so the state has announced that they are implementing a requirement that starting April 2nd, every high school athlete needs to get a COVID test before every practice and before every game in order for them to participate. So that's a pretty big announcement today. And again,
because with that, what's the reality of that? I love how our government officials put these policies in place without the reality. So if I'm tested before every single practice, we know that the rapid tests are not 100% accurate. So was that addressed at all in the press conference? Because I would imagine it's got to be a rapid test in order for them to practice that day.
Yeah, so that's completely fair. Obviously, getting any test is better than not getting a test when it comes to efficacy. But yeah, the state health department has told us, again, this was just announced 10 minutes ago. The state health department has told us that they're still working on the logistics of the program. But yeah, the ability to, the logistics around being able to test everybody, I think for some people is a concern. But as the state noted today, and as we've noted, and as experts have noted, the driver of cases in Michigan right now, it's not nursing homes, it's youth sports and schools in general. The state today said there are 315 outbreaks tied to youth sports, either public school sports, private sports, recreational sports at a K-12 level. That's not college, that's not pros. For the first time in the pandemic this last week, there were more outbreaks tied to K-12 than long-term care facilities. Obviously, that's in part due to the fact that the state has made a lot of strides in vaccinating people who are at long-term care facilities. But the driver right now in cases is sports and schools. And the vast majority of kids playing sports right now aren't eligible for a vaccine. So yeah, that's absolutely a concern in the state. In theory, if you test a kid and you were able to find out that student athlete is positive, you were able to prevent that person from, not only interacting with all the people that are on his or her team, but all of the other people who are competing against that person. If there's a tournament, for example, that could be an issue. Now it's my understanding, and you guys probably know more about this than I do, but the April 2nd date here is interesting and important because the high school basketball playoffs and the wrestling playoffs are essentially happening before that date. And those are two sports that have been drivers of outbreaks in the state.
That is interesting. Hey, I have a question for you because you've covered this at greater length than I have. So when it comes to testing and them counting the number of cases, if I go in for a rapid test, it's positive, but then I go in and get the PCR test, and that one comes back negative. Which one are they actually counting? Is that false positive being counted as a number of a case in those daily counts?
No, that's my understanding is that it's not. My understanding is there needs to be they're accounting for false positives. You're right. Obviously, false positives are happening. Both tests are actually overwhelmingly effective. You know, it's not like a 50-50 thing. It's more like even the rapid tests are closer to like 86%. And then, like you're saying, the PCR tests are even more effective. So there are false positives, but it's not like a massive problem. I will say that the majority of effort and focus has turned more to vaccinations than it has to testing. And so testing is and remains widely available, perhaps more so now than ever before.
And that's what I think is going to happen as well with the vaccines. We know CVS is going to start them. Obviously, with the mass vaccination happening at Ford Field, we are going to start to have more and more people vaccinated. But remember, back in the beginning of this, it was hard to get a test, a COVID-19 test, and also get those results back in a timely manner. Sometimes it was 7 to 14 days before you were getting the results. But just like COVID-19 testing, it's widely available. That's eventually going to happen with the vaccine as well.
Yeah, that's right. And the state's done a better job. Everybody's done a better job at that turnaround time on testing. The last time I checked, and it's been a while, the average test result was coming back in less than 3 days. So it's quicker. But to your point, you know, if there are, I don't know, 10 kids on a basketball team and all of them have to get a COVID test, you're wanting that rapid test right away, obviously. And then if one kid tests positive, that's supposed to set off a policy for the school, and that could affect, you know, any given game. Now, in theory, we want as much testing as possible, because not only do we want to stop outbreaks, we don't want anybody else who doesn't have to get COVID to get COVID, right? And the population that ardently fought for sports to come back argued that kids would, and parents and coaches and everybody else would be personally responsible, and that they would wear their masks and they would do everything they can and could to mitigate spread. At the same time, I think we've probably also all seen pictures of high school athletes, through no fault of their own, having their masks slip off when they're going up for a rebound or something like that. So it's a problem that the state and everybody else continues to grapple with.
Yeah, we've even had it just as members of the general population, when you're talking and your mask comes down. I feel so exposed. It's, you know, like a chick, you feel like, you know, it's like, oh my God, I'm exposed. Mm-hmm. You know, like you go diving and your bathing suit top is off. Oh my God, my mask is off. Right? We've all had those awkward situations now. With that, so we know that yesterday the governor did not really take questions after the big, you know, dog and pony show at Ford Field. Following that, though, she took questions today. Were most of those questions directed towards Gordon, or what was the hot topic today?
So there were some questions about the separation agreement that she has with former Health Director Robert Gordon. She was asked about, you know, why he left again now that they've waived the confidentiality agreement. And on one hand, she would say we wanted to waive the confidential agreement due to transparency, but on the other hand, she said he offered to resign, accepted his resignation, and we're moving on. And so every time the governor or former Director Gordon doesn't say Gordon left because of X, and they say he left and we're focused on the future, they're going to get more questions, you know? And if there was a statement that former Director Gordon sent to lawmakers yesterday that didn't, again, specifically say why he left, but it hinted that there were policy disagreements. It was kind of a general statement saying, like, educated adults can disagree on policy all the time, and that helps the state grow stronger, which is a completely, you know, valid perspective. But if that's what caused somebody to leave, just say it. I don't, again, if it came down to indoor restaurant capacity or some other COVID order that we don't know about, and the governor and the head of the health department disagreed, say it.
Yeah, it really is no big deal, which makes you think, okay, was there more to it? And we should note as well, Gordon is not a health official, he is an attorney. And so...
Yeah, but that's not unheard of. I mean, if you go look at the heads of departments, not only at the federal level, but at the state level, you could argue, the head of the Michigan Health Department isn't doing checkups and isn't making sure, performing surgery per se. That's what the chief medical executive does. That's Dr. Jonah Khaldun, and she is a doctor, and she's an emergency physician, and that's her role. The heads of departments are administrators.
Yep.
That's what they do.
Yeah, and I will say, I was a public information officer for a federal law enforcement agency. I wasn't an agent. I was not a gun expert. Never shot a gun until I went to work for them, and my thought was just that. I'm surrounded by experts. I don't need to be the expert. I go to you for the advice on these situations. With that, we have to kind of dip our toes in. I don't know how much you've been covering, obviously, with Gordon. The issue also surrounds the state of Michigan and the lack of transparency in some of our laws surrounding our elected leaders and the governor. What's the feel in Lansing surrounding that topic?
Yeah, so for the last several sessions, the House has really taken the lead on trying to expand the Michigan Freedom of Information Act and to create an entirely new act that would apply to the legislature. Right now, the governor and the legislature are exempt from open records laws. So I can get Robert Gordon's emails from the Department of Health and Human Services. I can't get the governor's emails from the governor's office because she's exempt. And same thing with the legislature. So the legislature, the House, is trying to expand that eligibility. They have a 10-bill package that just passed the House yesterday. It was a unanimous passage. It's passed unanimously before. These bills tend to die in the Senate, and they're dying in the Senate chiefly because of Senate Majority Leader Mike Shirkey. He has either opposed them publicly or privately or not had them come up for a vote. There's a similar, comparable 10-bill package in the Senate that has bipartisan support. It's sponsored by a Republican and a Democrat. It came up in a hearing the other day, and there seems to be, if it comes up for a vote on the Senate floor, it seems like they have the votes to pass it. Whether or not it makes it to the Senate floor is another question.
And this isn't a new topic, a conversation here in the state of Michigan. This has been proposed several times in previous years. We'll see if it gets any traction this year, because I think secretly on both sides, they do like it. They want to publicly say they support transparency, but my guess is they like being shielded in a way to help protect them in some of their deals.
Well, and these bills that they have proposed, while they are obviously better than not having anybody, than having everyone exempt from these laws, there are pretty obvious loopholes that are involved. For example, a record of the caucus, so a record that is deemed to be a record of the Democratic caucus or the House caucus would be exempt from disclosure under this law. That's pretty broad. In theory, somebody could define any document as being as falling under that. And so again, the devil's always in the details, and we'll see how this is actually implemented. They also have the bills aren't supposed to take effect, or the laws wouldn't take effect until the start of 2022, and any document created before 2022 would also be exempt. So we couldn't go back and try and get information from the governor's office or from the legislature. So again, it's better than nothing, but I don't anticipate that there won't still be fights from people like me or other people to try and get what should be public information.
Dave Boucher with us here on the Megacast. He's the government and politics reporter for the Detroit Free Press. And with that, too, people should understand so many times they think FOIA is just for reporters or for attorneys, and it's for everyone in the general public. But we also know even those that are subject to FOIA, there are ways around it. They just make the price so high. Like I put in FOIA request and you get back, thank you, it's going to be $10,733 for us to be able to process that, and you have to come up with half the money by tomorrow. So there are ways that some of these government entities get around actually, abiding by the FOIA rules and regulations, the spirit of it anyway.
Yeah, there's a fair argument to be made that we've already paid for those documents. Our tax dollars already paid for that information. and now we're paying for it again. I'm paying for it, you're paying for it, or whomever is trying to get it is paying for it. And yeah, it's entirely common to see FOIA requests that cost tens of thousands of dollars when, for example, you can put in the exact same request for separation agreements to every state department, and one department will get you all their agreements or let you know they don't have any in 10 minutes, and another department will charge you $400 to see whether or not they have any of those agreements. So a lot of it comes down to the individuals who are involved. There's also, they can charge you for labor that's involved. And so at one department, the person who's collecting that data might get paid $12 an hour. But recently I looked at a request I put in, and the person who's collecting the data gets paid $35 an hour. So obviously that's going to cost me more than the other requests. So yeah, there's still loopholes, and if people don't want information to come out, they're going to fight and do whatever they can to prevent it from coming out.
And we should note that this is actually Sunshine Week, which is a nationwide event of open government and making some of these public documents accessible. We do know some states put all their information online. I believe Ohio is one of those states as well. There's always ways around it and things that you need to do and dig into this. But again, we like to remind people they're paid by our tax dollars. We elect them, and this is our information. I'm so like, FOIA just gets my blood boiling. So let's go ahead and skip on to, because the more I think about it, the more I get so mad. Like, I used to put in FOIAs just to put in FOIAs because I love FOIAs, It's like FOIAs, by the way. That's a good one, It's like, hey, I'm going to FOIA all your FOIA requests for the past year. See who else put in the FOIAs and what they're working on, this, that, and the other, and you find stories that way. So there's a little tip for any new journalist that might be listening right now. Dave Boucher with us here, government and politics reporter for the Detroit Free Press. So many other things going on that you're covering as well. I mean, do we want to even get into some of these relief packages? There's still the stalemate between the GOP and Whitmer. Is the future bright on these two sides coming together, or more of the same?
I don't know. We'll see. I'm not optimistic. If actually I should rephrase that. If you're an advocate for people who need rental relief or who need food assistance, or who, a business that is hoping for some tax dollars to help out with unemployment funds, no, I would not be optimistic. There are several bills that are heading to the governor. She's got one already right now that is tied to hundreds of millions of dollars of funding that she'll probably veto. It's a bill that's related to taking away emergency powers from the health department. Two more bills are headed to her desk, representing more than $600 million in funds for tax relief for businesses, and also funds for non-public schools and parents trying to offset some costs of summer school. She's probably going to veto those too. She's already vetoed those funds in the past. She's already explained why she wanted to veto some of those funds in the past. And the legislature has, both members of the House and Senate have said it must be a mistake. She must have gotten this wrong, because these funds are warranted and they help people, and they weren't tied to any bills that would take away executive powers. I would be surprised if the governor vetoed $600 million in funds by accident. That's not really something that happens very often. And so there's every indication she's going to continue to veto that. I know it doesn't seem like it's election season yet, but the Republicans are absolutely 100% coalescing around the idea of defeating Gretchen Whitmer for governor in 2022. There's not like a consensus Republican candidate yet, but there's an opponent, and they are running and doing everything they can politically and arguably legislatively to launch their attacks.
Dave Boucher with us here on the Megacast. Dave, anything that we didn't touch on that you want to cover? Because there are so many topics. We could make this an hour conversation.
Yeah, no, I think we've hit on everything. Again, it'd be interesting to see if the governor and the legislature can find any sort of common ground on funding. There's a ton of additional funding that's coming in, from the latest stimulus that the Congress passed. And again, the thing that I'm looking at the most is COVID and case rates. Like these case rates are trending in the wrong direction. Michigan is one of the few states where they are trending in the wrong direction. And despite the state vaccinating, more than 2 million people at this point, we're seeing case rates are bad. Deaths are going up. Hospitalizations are going up. And the state is not at an exemplary rate when it comes to vaccinating adults in the first place. And so that's nobody wants to see new restrictions in place, but the case rates and other metrics that the state has used to justify restrictions are getting close to where they were in late October, early November, when the state implemented a bunch of restrictions. Again, more vaccines are coming in, so maybe that changes things, but we'll see.
But what's surprising to me is at that same time, she is loosening some of these restrictions. One being with the large stadiums, we know opening day is coming.
Yeah.
And I was really surprised that she loosened the restrictions around restaurants in time before St. Patrick's Day. We know people are going to gather. I was out on St. Patrick's Day. People were gathered. And so those numbers you would anticipate could be higher in the coming weeks. So again, it kind of goes to when they talk about the science and the data, but they don't release everything, but they make some of these decisions that seem to contradict the numbers. That's what leaves the public so confused.
Yeah, so again, there's been a lot of focus around this concept of science and data as though there is one number that everybody would agree upon, that if only we were below that number, then we could all go out and drink at a bar, and if we're above it, then we all have to stay home. And that's just not how this works. Again, this is a novel virus. Nobody knew anything about this time this year, essentially. I mean, people were starting to learn about it. People are learning something new about it every single day. And the state health department has said this many, many times, that it's less of like a red line and it's more of like a dial or like a range. And we're seeing now, even in the legislature, that people are starting to introduce bills where they're setting case rates and test positivity rates at certain numbers. And if it goes up to this, then we need to close something. And we don't know where those numbers are coming from. And these are coming from Republicans who have said that they're mad at the state for not meeting numbers. And at the same time, the governor, and she said it again today, uses the phrase personal responsibility, which is a Republican favorite. That's what Republicans want. They want, I mean, by and large, they want citizens to have the capacity to make their own decisions. You know, they don't want a mask mandate. They want citizens who want to wear masks to wear masks. The governor said it today. There's personal responsibility. If you want to go out to wear a mask, Dr. Calhoun said just because something's legal doesn't mean you have to do it and that you need to do it. You can still wear your masks. And so, yeah, I think that there's pressure to open businesses on the governor. There's also pressure from lots of people who think that, no, that we need to slow that down.
We'll see where it continues on, because the argument will not be over with the vaccine. Dave Boucher, we always appreciate your insight. Thank you so much for taking time to be with us.
Thanks for having me. I appreciate it.
Dave Boucher, he's the government and politics reporter for the Detroit Free Press. Follow him on social media, but more importantly, please subscribe to the Detroit Free Press, the Detroit News, MLive, anyone and everyone that you can support, because subscription base is how they are supporting local journalism, and it is so important, especially now. We're going to take a quick break here on the show. When we come back, the chief of the West Bloomfield Fire Department, Greg Flynn, will be with us here on the show.
Perry tested positive for COVID-19. Emma was exposed to a friend who's positive. Willa's waiting on test results. After any contact with COVID-19, or if you test positive, stay home for at least 10 days. If you live with others, keep your distance and wear a mask. Help Michigan contain COVID-19. Visit michigan.gov/containcovid.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Always great to have you with us here on the Megacast. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keefe. It is Friday, the last day of winter. The sun is shining and vaccinations are flowing. Hope is in the air.
It is, and what a beautiful day outside, and a beautiful time to be alive as vaccinations continue to go out in our community and all throughout the state of Michigan and the U.S. as we inch closer, hopefully, to the end of this pandemic, but do so cautiously.
Greg Flynn with us now on the show. He's the chief of the West Bloomfield Fire Department. You and your team have been a huge help in getting the vaccine out to members of our public, and we want to say thank you for that.
Well, good morning, Tyler and Ronnie. We play a small part in a greater mission that are the healthcare professionals at Oakland County, at the pharmacies, at doctors' offices, and hospitals across the great county, of all of Oakland County, as they get these vaccines into arms. They're doing a great job. We like to open up our fire station to that and provide them a safe place to do that, but they're doing most of the heavy lifting there. But thank you.
With that, though, when you see the numbers start to go up, with the number of vaccines becoming available here in the state of Michigan, does it give you a sense of relief that you're hoping that this is coming to an end? Because you and your team have been living this each and every day on the front lines.
So I guess we have to define what end looks like.
I don't think we're going to be going back to what we used to know, right?
Right. When we go back to the Spanish flu, 100 years ago, looking at what literature, what the news was saying, what medical records were saying, this was like a 3-year process before they really felt like they were clear of it. Now, do I think it could be 3 years lingering? Again, we're already 1 year in, and sure, I think there can be lingering issues. Do I think those are going to be, there's as much airtime that CNN is going to continue to have that right column every single minute of the day up and in our face? I don't think so. I think those things will start to fade away, but I think your science, your research, the medicine side of it, the vaccine boosters, all that's going to continue. And we're going to adopt some great things like we've said since day one. I've never seen so many clean hands as you walk around as you do now. And my goodness, this is a great thing that we're doing that and understanding disease transmission. Remember, it happened 100 years ago too, and then it faded. So, we forget about those things over time.
And the good thing, we did not see the flu cases this year. And I think in part that was because of the measures that we were taking to avoid COVID.
Science isn't that hard. I think sometimes we make things so much harder, but we need to understand it. I hear folks talk. I just jumped off of a state call to join you guys, and the state EMS medical director was speaking. And, we're to compare numbers to a year ago and start to say that there's another surge or there's this or that. We're in a completely different place than a year ago, and you're comparing data sets that aren't completely, in my humble opinion, they're not apples to apples. And so, we understand a lot more about the virus, and I can tell you that our calls are flat, if not extremely low. Our cases, we still get people that get positive. But we're finding there's so much wide community spread, Ronnie, that you don't even know where people are getting it from at this point because it's everywhere, and we're not seeing the hospitalizations. Our friends at Henry Ford, I don't know if you've had any of them on lately, what they're saying, but the most recent conversations I've had, they're not in this spot that they were in April and May. I'm sorry, February or March. Yeah, April, May of 2020. So we're in a much better place there.
Yeah, and when we look at the numbers, but a lot of this has to do with understanding this virus, adapting to the virus, but how do we treat the virus? And how we're treating it today is completely different than how we were treating it a year ago.
For sure. And we have plenty of, real live data that's coming in that's saying, hey, here's a group of people that took this approach, and now we have nearly 8-9 months worth of follow-up to that. And we're going to see it. I have a college student. I am sympathetic, but still practical about what college should look like for him and what his mother and I would like it to look like. He's at the University of Michigan, very proud of that, but he's at home with us. And there is a development part that we were looking forward to our son experiencing that he hasn't been able to experience. So we're anxious to safely get back to those things, but everything we do takes on risk, everything we do. And, I think we've got to learn to live with some of the risk that's out there. And I think many people have demonstrated an ability to do so. And illness has been around us. I think, again, we're putting so much emphasis on COVID, but we have dealt with the flu, and we experience things like this every year in healthcare that doesn't get this much airtime. And so I think we do need to bring some balance to the conversation.
Yeah, I like that. I will say my niece, she also goes to the University of Michigan. Go Blue.
All right.
Tyler is cringing right now. But she's set to graduate. And currently they have plans for virtual graduation. And, you're kind of like, well, you're at the big house.
Yeah.
You can have, separate maybe per program or this, that, and the other, but you're at the big house. You should be able to have some type of graduation ceremony for some of these students because they are missing out on so many things. But on the other side, they're living through history. They're going to remember that first year of college when they couldn't get out or they were in the dorms. My niece has an apartment at the University of Michigan. She's there with 3 other roommates. It's just her and the one roommate. The other 2 roommates are still at home, choosing to go remote with that. So there's so many decisions for so many people to make throughout this pandemic. I will say the good thing about the state of Michigan being remote where Ohio is open, all the college kids are back in-person classes. So my nephew couldn't leave to go on spring break because he had to be in class. So, if you're remote, you can work from anywhere.
That's right. Well, and I want to be careful here. I don't want any of my comments to be disrespectful to anybody that has lost someone to COVID or is, I get that many people have lost their lives to this. I just think it's important to have as part of the conversation that we have had an opioid crisis in this state, that we have lost thousands of people to. There's motor vehicle accidents, death by suicide continues to be the 10th leading cause of death across the United States. I do, as a person in public safety and crossing over into healthcare, the point I'm trying to make in the conversation is there are people suffering in lots of ways. And we need to keep our eye on all of those things too, as we continue to learn how to live with COVID. And this approach sometimes I hear in conversations is all of a sudden someone tells a very dramatic story, which is just that, it is. But I don't know that we should be basing everything off of those stories as we look at public policy for the masses. And that's hard. That's hard for public health. That's hard when there's a news story that pulls at our heartstrings, and then you're looking at a business owner who's failing because they can't get anybody in the door. All of these balls are in the air, and that's what makes this so hard to have a conversation about, because you sound like you're on one side or the other. And I don't know that there's a side here. I think it's just being informed and moving forward and trying to make good public health decisions.
Yeah, I don't think there is. It's like you said, there are so many aspects to this as we continue to move on, and we'd like to remind people as well not to put off those yearly health screenings because those are so important during this time as well. I know people that did not get those screenings and now they are further along in an advanced stage of a disease that maybe could have been caught at an earlier stage. So we have to remind people we need to continue to live our lives as well and be cautious of some of those other things. It is okay to go to your doctor. It is okay to go to the hospital. It's okay to get those screenings because those are important things as well. And I think that that part of the conversation kind of got started late because there was so much focus on COVID. And so some of those people did miss those screenings. So hopefully the conversation has expanded to allow people to feel more comfortable to visit their doctors right now.
Yeah, I haven't seen my veterinarian for Ruby in a year. I mean, one of the texts comes out, she goes into the building, I wait, and then they text me, and then I go and pick her up at the door. So there are lots of things that have changed, but we need to keep finding how we can reintegrate. I'm a social person. I miss that social interaction. The Zoom did it for a little bit. It just doesn't cut it anymore. I'd love to be in the studio with you guys. I'd love to be shaking hands again and doing those things that just connect me with people. That's just where I am. And but I need to modify those things to keep others safe and keep my family and everybody safe. But I think we're doing a good job, and we need to continue to celebrate the successes that people are having while being conscious and aware of what remains out there and the dangers that can linger if we're reckless with our approach.
So I have found, Chief Flynn, that it's a little bit like, when you lose power, you walk into a room, you automatically still flip the switch. You don't have electricity in your house, but you're still flipping the switch, right? It's automatic. I'm that way when I see people that I haven't seen in a long time. I go in for a hug, and then you have to stop yourself and say, wait a minute, you can't do that today. And you also have to gauge where other people are and respect where they are in this virus as well.
Yep, and we're gonna navigate that, and it's gonna be weird for a bit, and who knows? In a couple of years, maybe we're gonna find that that's where we're back to, and as long as everyone can do that and feel comfortable, then so be it. But this will definitely leave a mark on us as far as the history of living through this, like you said, with not just those that are in college, but those in healthcare and those that are teachers and those that stay at home as a parent, and what that was like. I mean, I can only imagine having a small toddler or younger during this and just feeling that's how I got out. I mean, I always took the boys out and did stuff when I was home with them. And, because I had those 24-hour shifts, I was home 3 days out of the week with the boys while Danielle was at work. And so it was, again, I do appreciate where some of those folks are, and that's tough. It is. It's very tough.
You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. And with that, Chief, if we can talk about kind of your industry right now. We know there is a teacher shortage currently. We know the police department is experiencing shortage as well. How about the fire department? Are you guys hiring over there, and what's that process look like?
We're very fortunate here as we continue to work on a culture that will attract an inclusive culture, a culture of diversity, to be reflective of the community that we serve here in West Bloomfield, Orchard, Kego, and Sylvan. I will recognize that there is nationally a shortage of paramedics and firefighters. I'm proud to say here that we're only have one opening. We have a candidate that we've got our eye on at the Fire Academy currently. We're just kind of waiting to see how they do there. Then we'll be at 100% of our budgeted position. So we are very grateful for that. And I think a lot of it comes down to, you hear so much negativity about being in public service, and we just don't want to play into that here at the WBFD. We think it's a great career option. It's a great engagement with the community. It's something new every day that this township supports their paramedic firefighters with great equipment and a safe building to be in. So we're in a good place, but I am conscious that, yes, there are colleagues in Warren and Southfield and other places that will exactly say that you're kind of hunting for those folks, but we've been very fortunate so far here.
That's great to know, and it's because it is a great community. I think our community supports what you do and even what our police officers do here each and every day, because we know it is a sacrifice as well. With that, just a couple more questions before we say goodbye. How's your budget looking through all of this?
Well, our budget is doing great as far as what we were predicting. That's exactly what a budget is. We predict these expenses. We're staying within our budget. We're taking advantage of all of our opportunities for additional sources of revenue through the CARES Act, through additional funding that may come available, whether those are federal dollars or federal dollars that go to the county for distribution. We continue to leverage that. Our Deputy Fire Marshal, Dave DeBoer, is exactly tuned in on that frequency and is right at the front of the line. And we're ready to go with shovel-ready projects that can be applied for reimbursement. We just got word that we got nearly 80% reimbursement for some things that we put into the state just earlier this week. So I'm very pleased by what the staff here at the FD is performing, along with our friends in finance for the township. We're getting the job done, and we're taking care of the taxpayers' tax dollars and leveraging them in the best way to serve them.
Well, those are tax dollars that we like to spend supporting people such as yourself and your entire team over there. Chief Greg Flynn with us here on the Megacast for the West Bloomfield Fire Department. Anything we didn't ask that you want to maybe touch on before we say goodbye?
Well, I think one thing to touch on as we wrap up is the weather is nice, and I continue to watch some of the social media pages for citizens concerned about West Bloomfield, and I continue to hear about the amount of trash along our roads. You're looking for something to do, let's grab a bag and all lend a hand and walk through our neighborhoods, walk up and down safely, make sure you have something high vis on, and be careful. But let's all do our part to clean up West Bloomfield. The Optimist Club of West Bloomfield is planning to clean up on Orchard Lake Road for Saturday, April 24th. And I'd love to come back to, and maybe we can get some of the other groups that have adopted a road in Oakland County and work on that across the county of getting things cleaned up after really a great winter and moving into a spectacular spring and summer.
That's a good note to leave on. Get out, enjoy the nice weather, clean up our neighborhoods as well. Chief Greg Flynn with us here on the Megacast. Thank you again for your time.
You're very welcome. Good to see you guys again.
Okay, happy weekend to you.
Right back at you.
We're going to take a quick break here on the Megacast. When we come back, we are going to be joined with the managing director for Ready Nursing Solutions, how they are doing their part to try to help all of us get vaccinated during this pandemic. This is the Oakland County Megacast.
As rivals, we don't always see eye to eye.
Like who scored the best recruits?
Who's going to be who?
And whether we wear green or blue.
But one thing we can all agree on to help stop the spread of COVID-19. Wear a mask.
Wear a mask.
Wear a mask.
Wear a mask. Wear a mask.
The ball's in your court, Michigan.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Great to have you with us here on the Megacast. As a reminder, you can always catch us on Civic Center TV, Birmingham Area Municipal Access, except for today. They're having technical difficulties over there
We're
today.
with Birmingham Area Municipal Access today. 88.1, the Biff is not with us today due to technical
Oh, it's the radio. Okay.
Yes.
But you can listen to us on 89.3 Lakes FM, or tune us into the radio, or Channel 15 on Comcast, 99 on AT&T. It's Friday.
And you know what? We're always there. You know where we are. It's okay. You can find it all on civiccentertv.com/megacast if you don't. So we're good.
And I will say one of the best things about that, so many people that maybe don't live in Oakland County. I have a lot of people that watch in Ohio, but they can go back to the website and catch full episodes of the Megacast or just individual interviews as well. So as we continue on, trying to get as many people vaccinated as possible to reach that herd immunity here in the state of Michigan, it's taking a lot of effort and a lot of help and a lot of logistics. And one organization that is helping here in Oakland County is Ready Nursing Solutions. With us now on the show to talk more is Saritta Hines. She's the managing director. Thank you so much for being with us.
Thank you for having me.
It's great to have you. And tell us a little bit about Ready Nursing Solutions.
Ready Nursing Solutions, we started off as a temporary staffing agency. We've been working with area hospitals in Metro Detroit for the last 20 years, and we recently heard the call from the administration, and we had the nursing staff, so we applied to become a mass vaccinator, and here we are today.
So you're working with the Oakland County Health Department. How is this working? Do you have certain locations that you're going into, or are you going into people's homes?
We do both. So we work with long-term care facilities, assistant living facilities, independent living, as well as we go into homes, so we work with homebound individuals as well.
That has to be such a relief for so many people that are in their homes, because you're hearing about, all these opportunities to go out and get vaccinated. But if you can't leave your house, you have to feel like you're left out.
Yeah, definitely. And, that was our main goal, is that we wanted to reach, that part of the community that's, traditionally left behind with these MASH initiatives. It's like, how do we reach them? How do we bring services to them?
How's it been going so far?
It's been good. I mean, a little overwhelming at times. So it's just, trying to ramp up to speed. But we just, we want to make sure that we reach everyone.
With us right now on the Megacast is Saritta Hines. She's the managing director for Ready Nursing Solutions. How is staffing on your side? Because we are hearing about staffing shortages across so many industries right now. And, we're no different. We are definitely facing some challenges with staffing. Staffing with nurses in particular, that's a nationwide shortage. We're definitely looking for those individuals, whether if they're LPNs or RNs, as well as student nurses, because, with the emergency declared, student nurses are able to give vaccinations as well, as long as they're under the supervision of their teacher. So with that, what great experience for some of these students, huh?
It is. It's a great experience with them. We've reached out to a few universities, and we're excited to the opportunity to partner with them as well. And we're looking for more as well. And also this is a great opportunity for those who are kind of undecided, in which direction they want to take career-wise. This is definitely something to consider.
So with us right now on the show is Saritta Hines. She's the managing director for Ready Nursing Solutions. And you said you applied to be a part of this effort. What was that process like?
It was straightforward and intensive at the same time. So it was a lot of paperwork required, but the process was streamlined. They made it in the way that you had a checklist, make sure that you had the proper insurance, that you had, everything in line, that you had the proper medical directors, that you had, everything in line, but they streamlined the process. I would say that, Michigan did a very good job at that. Everything was electronic. It was just, a really smooth process.
What's it been like to be able to be a part of this process, especially for the ones that are so vulnerable, going into some of these nursing facilities and these long care facilities? It can be emotional.
It can. It's a tearjerker because, they just say, we've been trying for so long and we just thought, they forgot about us. And it's like, absolutely not. We did not forget. We just made this, our priority to come and make sure that, you guys are taken care of, because we get it. I understand. I just want to make sure that, we get that group of people, who are traditionally left behind, and make sure that you have a way to, you have access to this information.
So with that, how long do you anticipate that you're going to be taking part in this program?
It really depends on how long COVID is with us. and we just don't know. We've been hearing from the scientists that, they're doing those, the booster now. So that seems like it's something that we'll be doing every year. And we just don't know. So it seems like it's something that we'll just get, I'm assuming, every year, kind of like how we do the flu vaccine.
Talk about the logistics that goes into something like this.
It's a lot, and we're learning as we go. It's like, I joke with my team all the time. I said, okay, we have our daily stand-up meetings. I said, okay, everything's on fire, but what's burning us right now?
That's one way to look at the day, right? So with that, because give us a number breakdown about how many places are you visiting, how many homes are you visiting, because if you go to a home, that's one person, but it takes longer to do that one person than maybe 50 people at a nursing facility.
Exactly. So the way we initially started is that we do nursing facilities Monday through Thursday, and then we do homes Friday and Saturday. And that was because of the vaccine transport coolers. And that's another problem. There was a shortage on those. So we couldn't have, a nurse go to more than one location because you only have one vaccine cooler. So, we work with the county and they got us another vaccine cooler. So now on a typical weekend, we would be able to do, or let's say on a weekend, we would be able to do 100. So now that we have another vaccine cooler, we can bump that up to 200. And as we keep going, we can just, the more vaccine coolers we get, the more nurses we can add.
See, these are the things that we in the general public don't know and don't understand. There are so many steps. It's not just a matter of, hey, I'm getting the vaccine and this is the program. It's the A, B, C, D, and E in between. When it comes to the nursing facilities, they've just now recently opened them up for visitation. Have you or any of your team members been there to witness some of these reunions with family members?
No, not yet. I think we probably will when we, when we go for that second dose. I think we'll be able to witness that.
So what's the scheduling like on that side? So you're doing, the first dose, but now you have to go back. So do you have to get back there within so many days of when they receive the first one?
Yes. So if we're doing the two vaccines that we have is Johnson & Johnson and Moderna. If it's Johnson & Johnson, then it's just one dose. But if it's Moderna, that second dose has to be 28 days after. Then we have to schedule them after that and then come back out and do the second dose.
Saritta Hines with us here on the Megacast. She's the managing director for the Ready Nursing Solutions. They are helping to fill in the gap to try to get as many people here in our area vaccinated. So many homebound seniors, you are able to help them. But for people that are at home who are just hearing about this program for the first time, how can they sign up to get on this list?
They can contact us at www.getreadyvaccine.com, and they can fill out our patient intake form, and it'll ask them what organization are they a part of, and they can just select other. And then we'll be able to contact them when we have a pop-up clinic in Oakland County.
How often are those happening? What's typically the time frame that you're looking at?
Yep, so we're actually having our first one April 6th.
And so tell us more about that.
Yep, so we're going to be scheduling that for our group homes. So we're working with some group homes in Oakland County for those who are mobile. We're scheduling them earlier part in the day. And then we'll have some extra vaccines ready for other people in Oakland County as well. I believe they're opening up April 6th will be everyone, the new state guideline open it up, so we'll be able to vaccinate those as well.
Well, so are we talking about then you'll be a part of the mobile vaccination clinics that are going to go out to maybe community centers and into some of the neighborhoods?
Yes.
Wow, that's great. But with that, that's going to require more employees.
Exactly.
So if someone is out there listening and maybe they were a retired nurse or, maybe someone who needs a little bit more flexibility in their schedule because they're homeschooling their kids, how can they try to sign up?
We also have a volunteer form on that on our website as well on getreadyvaccine.com. So if they can sign up there, and I know it says volunteer, but they can put either if they want to volunteer or if they're just looking for some extra hours.
With that, Saritta, how do you know which vaccine you're getting each and every day? Because do you have people who say, I only want this vaccine or that vaccine?
We do, and it's a struggle. We really only know that week, and our priority is definitely to the people who already got that first dose of Moderna, and we will send out a reminder, 24 hours before their appointment to let them know, which vaccine we have, and then we definitely give them all the information on each one, and it's a family decision at that point.
Saritta Hines with us here on the Megacast. She's the Managing Director for the Ready Nursing Solutions. We so appreciate your time.
Thank you for having me.
We hope that we weren't part of your day-to-day conversation about what's on fire today.
Yes.
Well, we do appreciate it because we know you're extremely busy. So thank you again for sharing this information and sharing your time and everything you're doing as well to try to reach as many people that need it here in our community.
Thank you. Thanks for having me.
Managing Director Saritta Hines, Ready Nursing Solutions. If you know someone who maybe can't leave their home, they're going to help fill in the gaps. Please seek them out, but also they're going to need more people to help them in this effort. So if you're a retired nurse or someone else, please go ahead and reach out to them and they'll work with your schedule so that we can try to get as many people vaccinated as possible. We're going to take a quick break here on the Megacast, and when we come back, Representative Brenda Carter is going to be with us here on the show. This is the Oakland County Megacast.
Michigan, the coronavirus pandemic has put us all to the test, and now it's time to put COVID-19 to the test. As we move forward, testing will be critical. We encourage anyone who has reason to get tested to do so, those with symptoms and those without. If you are leaving home and going back to work, get tested. If you think you may have COVID-19 or you've been exposed recently through family, friends, or coworkers, get tested. Our test locator tool can help you find the right testing site that fits your needs. Even if you're looking for easy access with no cost, no prescription, and no appointment necessary, we've got you covered. Help Michigan move forward, not backward. To find a testing site or learn more, visit michigan.gov/coronavirus test. A message from the Michigan Department of Health and Human Services.
The only way to beat COVID-19 is to face it.
You can't get too comfortable.
You can't forget the danger.
Wear the mask. Wear the mask.
Wear the mask. Wash your hands.
Keep a safe distance.
Especially in the next few months.
We'll get back to normal.
We'll get back to normal.
We'll get back to normal.
Someday.
But not yet.
Not yet.
Not yet.
But not yet.
But not yet.
Consider virtual gatherings for the holidays.
Curbside food orders.
Grocery delivery.
And shopping local. Shop local.
And especially shopping local.
Let's beat this virus. We can if we face it together.
Together.
Together. Together.
Together.
Together.
Together.
Together. Together.
Together. Together.
For the latest information, visit oakgov.com/COVID.
We appreciate your time on this Friday morning. I'm Ronnie Dahl here in the studios alongside Mr. Tyler Keefe. As a reminder, you can always catch us on Civic Center TV and also 15 on Comcast. If you have Comcast, thank you. Channel 99 if you have AT&T. As a reminder, a portion of that cable bill does help support programming such as this. You can also tune us in today to 89.3 Lakes FM. So many things a year into this pandemic that we continue to navigate, especially in Lansing with our elected leaders. We're always happy to bring in our next guest, Representative Brenda Carter. She represents the District 29. Always great having you with us. How are you?
Hi, Ronnie. It's great to be here again, and thank you once again for inviting me.
Before we jump into the politics of what's going on in Lansing, can we talk a little bit about your education policy town hall that's going to be happening next week?
Yes, this is another in a series of town halls that we've been having. We've invited our superintendents, and this time we're inviting our education associations, our Pontiac Education Association, as well as one of the stakeholder groups, one of the grassroots groups, and finally a representative from the governor's office. So that is exciting. So we're trying to take an overall look, not just from the administrative side of education, but from the teacher's point of view, the community's point of view, and get everyone's feedback, and most importantly, disseminate this information throughout the district and give our constituents an opportunity to ask those hard questions about education.
Well, there are so many hard questions right now because one plan doesn't fit every family.
Absolutely. And we are actually looking into that. I would like to say, this is my personal opinion, Brenda Carter, that we're very fortunate to have an education committee that is comprised of educators, teachers. Okay, yeah, I said it last term and I'm saying it again. We have teachers, we have board members, we have union presidents. It really takes a holistic viewpoint of education. And although we may not be as successful as we want to be in some of the things we are fighting for, I truly believe the overall goal of the committee is to produce the best possible policies we can for educating our children.
How important do you think it's been for you to have the background in education that you had coming in to representing us here?
I think it has been extremely important because I started off student teaching, okay? So I had that teacher background. But when I came on the Board of Education for the City of Pontiac, it was a whole different level of education. It was looking at the human resource part of education and the budgetary parts of education and employment and the whole 9 yards, as well as community engagement. And then taking it a couple steps higher, being the president of the Michigan Association of School Boards, which was invaluable to me because everybody's school district isn't like Pontiac's. And I learned a lot about going up to Marquette, Risa, in the Upper Peninsula. I mean, it was a true learning experience, as well as going over to the west part of the state in Kent County. So I was able to go to Saginaw and go to Adrian and visit these school districts and see how they were educating their children, as well as with the National School Board Association. I was able to go to New York, Ohio, Illinois, Colorado. I was able to go to all of these various state associations when I was the state president and get best practices from them. So taking all of this into the education committee, and there were several board members, school board members who are on the committee, including the current chair of the education committee, which is Pamela Hornsberger from Land's Cruise. You know, we have that background, and then we also have teachers, union members, and we all come to the table and we view everything that's coming across our constituents' concerns, our education community's concerns, our labor unions' concerns as it pertains to education, and we hope to bring forward the best possible policy for everyone.
State Representative Brenda Carter with us here on the Megacast. She represents District 29. So I'm going to put you on the spot here. How well do you think you would do if you were still teaching right now in this world of remote teaching?
Well, that is on the spot, Roddy, because I do talk to our teachers. And one of the things I learned as a board member, because I taught in the last century, and I mean way back in the last century, and my school board membership came after I left General Motors. But I learned from our teachers how passionate they are about educating our children. The majority of our teachers will do anything, including taking on a second or third job, just to make sure that that little smiling face at them have crayons and books, because that's our future. So as far as what our teachers are doing, they are essential workers. As far as I'm concerned, when we were in the earlier part of the pandemic where we didn't know whether or not our children could transmit the coronavirus or whether we were going to have vaccines in time to go back to face-to-face learning, our teachers still took it upon themselves to say, regardless to the risk, I'm going to educate children. So I feel I'm proud of them. I will fight for them. I think we should do everything we can to make their jobs easier.
Yeah, they really are some of the biggest heroes throughout this pandemic. It's not been an easy road, and we are not out of it just yet. So I'm sure they appreciate all of the support that you're giving them. If we can kind of jump to Lansing now, budget talks. Can the two sides get along and come up with some decisions?
I think we're on the path, okay? But you're reading the news, and there's always good news every single day about the clashing that's going on. But I believe we're making headway. The $1.9 trillion stimulus is going to help state governments with what they're doing. I know it's definitely going to help Michigan, but I believe our number one concern still is, making sure that our communities are safe, that we have a grasp on this coronavirus, because just 2 weeks ago, the numbers were almost nil. And all of a sudden, here they are spiking up again, and then until we get this under control, or at least some type of, gauge around them, we're going to always have the problems that we have. Now, there's two distinct sides to this, I guarantee you this, but I believe everybody in the House wants everybody to be safe, but they also want our businesses to survive. They also want to see our economy return back to somewhere to normal. So the quicker that we get this virus under control, the quicker everything goes back to normal. So, and I believe that is the argument, put lack of a better word, about what's going on, the dissension that's going on between the two sides of the House.
So with that, we read the headlines. And is this something that behind the scenes, the two sides can work across the aisle, but that's not what's being publicly told? That story's not being told because the clashing does get the headlines.
Well, some of the things I've witnessed in the chamber last week, I would probably go to the headlines, okay? And that's not the media, okay? That's me sitting back saying, really? But I'm serious. But I really would like to think that we are going to resolve this, okay? And I know there's enough compassion across the aisles. I talk to my colleagues on the other side of the aisle all the time. And of course, I've sponsored several pieces of bipartisan legislation, which means I'm able to reach across the aisle and work with my Republican colleagues. I'm hoping that we will come to some type of consensus soon, because we really, really, really need to address the needs of our constituents.
And at the end of the day, the two sides all want the same thing. And that's what the community wants, and that's for us to be safe and get our economy rolling. Once again, it's just how do we get there? Can we make a compromise and get there safely? With that, though, if we could talk a little bit about transparency in the government. There is a bickering back and forth about some of these confidential agreements and settlements. They're very common place in the private sector, and there is some argument about should they be allowed in a public sector when taxpayer dollar is paying for it, or if so, should that be shared? Do you believe that the state of Michigan should be more transparent when it comes to opening up some of our FOIA rules and regulations? Because when we look at the nation, we're at the bottom.
And Ronnie, ironically, you bring that up. When I was doing my master's degree at Oakland University, one of the things we talked about was Michigan and the Sunshine Law, and where we are, I think we were a D or an F, and that was way back then. So, yeah.
And this is Sunshine Week, we should point out as well.
Yeah, and I do believe, and I think a series of legislation went through the House of Representatives this week, actually talking about not voter transparency, but transparency in government. And I think all of those bills passed through the House. So I don't have them handy. I didn't come prepared for that, but of course that's easy to Google. If you have those news sources like Gonwer and Mears, it's right there, I'm sure. But yes, I think both sides of the aisle is concerned about making sure that government is transparent.
But as someone, you are an elected leader, so that would make your emails and your documentation open to the FOIA laws. What are your personal feelings on that as someone who would be impacted?
I think it's within, if you take an oath of office to say that you will do a job for the people, and we know full well that our records and everything is public knowledge at this point. No, I mean, it's just part of the job. And, really seriously, I know some people may not feel that way, but I do.
And I will say, as someone who worked for the federal government, we knew our emails were FOIAble. There were some things that would be redacted due to law enforcement sensitivity, but you knew when you wrote that email that it could be made public at any point in time, and so you operate knowing that as well. Yes. With us right now, we are always happy to have with us Representative Brenda Carter. She's with the Michigan District 29, which of course represents so many of us here in our area, including Keego Harbor, Auburn Hills, but Pontiac too. We are seeing some good things going on there in the city of Pontiac.
I am so absolutely pleased with my home city, which is Pontiac. It wasn't too long ago, I would say back in 2010, that both our city and our school district was in trouble with the state financially. And the school district was in trouble not only financially, but academically. And through the hard work of the elected officials, the school district, which I was a part of till 2018, literally turned their $51 million deficit into a fund balance this year, which I'm incredibly proud to be a part of that transition. But also in the city, if you look around, M1 Concourse, the Strand Theater, Amazon, we're about to get hopefully this Woodward Loop where we're going to create a beautiful downtown that would open it up to our downtown businesses. I think Pontiac is moving in the right direction, and I know the school district is.
Yeah, school districts are vital to a town's recovery, to a city's recovery, and that's why there's been such a big push in the city of Detroit to figure out Detroit public schools. So in Pontiac as well, I've been telling so many of my friends that are in their 20s and early 30s looking to buy their first home, they're priced out of some of the surrounding neighborhoods. I'm like, you really need to look at Pontiac. I think that's going to be the next big place to explode if they can all come together and get that development component right. There's so much potential and possibility there. You're also on the insurance committee.
Yeah.
You just like headaches.
Well, first time when I was placed on the insurance committee, and if we go back in time to, I think I talked about this, I was like, I understood family, children, and seniors because I'm an advocate for families, children, and seniors, and I definitely understood why they put me on education. That was, in my opinion, a no-brainer. But insurance? I learned so much from the insurance industry last term that I asked to be the minority vice chair, would have been the chair of insurance if we had gotten the majority, but we did not. So I asked to be the minority vice chair, which opened up my world to so many different aspects of insurance. Most people, when they think about insurance, they think about auto insurance, the little gecko or whatever that is, the little guy that goes across, or that emu, whatever that is.
Oh, those commercials drive me crazy. But you remember them.
But there is life insurance, property insurance, health insurance, pet insurance, all these different iterations of the insurance industry. And what I am beginning to be privileged to learn is all of these. They're coming now. I have the opportunity to learn from a real deep level the insurance industry and how that affects our constituents. A lot of people are concerned about their health insurance.
And I know there's no easy way to answer this, but the biggest question really is, why is health insurance so expensive?
Oh dear, I have an idea, but
I mean, there's no easy answer to it, but it has really skyrocketed through the years and really has become such a huge cost for so many people in their households as well, especially if it's not a part of their employment plan.
And what I'd like to say on that, and keep in mind, Ronnie, that I'm really at the beginning of this very steep learning curve with insurance, and I'm very pleased to have Representative Dare Rendon. She's the chair of the insurance committee, who was also a friend of mine before she and I went to the House of Representatives. So there was a relationship there between Dare and I. But I would go out to say that it actually is the cost of our medications. That is a big part of it, as well as the cost of our hospitalization. And what we're looking into, Dare and I, we've asked the speaker, could we get a little bit more involved in the insurance part of health policy so we could identify some of these costs and maybe hopefully make recommendations to regulate them. Case in point, we just had a very important piece of legislation go through the insurance committee this week, which was the parity for oral chemo. Okay, there is a difference between injections like insulin and then the oral that you could take at your home. And we had several passionate people come on and testify to being able to take this drug at home versus going into a hospital and being there all day and being stuck and prodded. And these are life-saving drugs for these individuals. And we were able to pass a piece of legislation out there pretty much unanimously in support of allowing the industry to provide oral chemo drugs to their patients. There was, of course, the argument of, well, who's going to take the cost, or whether or not this will impact the constituent or the patient adversely. But we worked out, both sides worked out some agreements pretty much to kind of keep that under wraps and keeping in focus the fact that our constituents really need this service. So this is some of the things we're working on in insurance, which would not have been in my wheelhouse when I was on the Board of Education in Pontiac. I still was looking at the little gecko. But it is now, and we're able to make a difference, and that's the key point. I would like to mention Representative Samantha Steckloff is an oral chemo patient, and she testified very passionately about what it felt like to have to go in there and they couldn't find veins, or they had to keep her there all day, and how her life was disrupted because she couldn't take a pill at home. So what we were able to do with this legislation, I think it's House Bill 4354, was to put some utilization management and drug transparency verbiage into the bill, which will hopefully address that cost disparity that you were talking about.
Well, sometimes we need our legislators to catch up with the science and bring those two sides together. You really do like a challenge, though, let me tell you. With that, just another minute or so here before we say goodbye. This, of course, is Women's History Month. Anything you want to say on that topic, or talk about any of the mentors you've met along the way?
Well, I'm going to give a shout out to the Women's Officials Network. This morning I left the network because they passionately felt that I had a little bit too much on my plate, and they felt my value was probably better spent doing what I'm doing in the forefront of fighting for the rights of all, particularly women. Anyway, but yes, also I'd like to give a shout out, Ronnie, with your permission, to the women in District 29 that we are honoring this month. And all of these people have contributed something significant to District 29. First of all, we are going to recognize from the city of Auburn Hills, Veronica Mitchell and Cheryl Brevecki. Veronica Mitchell was the former city council person for Auburn Hills, and Cheryl Brevecki was too. Over in the city of Pontiac, we're recognizing Rosa Randolph, Mary G. Evans, and Maddie Hatchett. All of them are pillars in the community of Pontiac. Now, here's some names you might recognize. Over in the city of Kego, I love Kego. Kego Harbor is Karen Meadrod and Kristen Sonneville Douglas. In the community of Sylvan Lake, we're recognizing Nancy Hunger and Nicole Anderson. And finally, to bring up the rear, we're recognizing in the city of Orchard Lake Village, Liza Lazarus and Duane Sonneville. So these are incredible women across District 29 who have done phenomenal things in our district.
Well, we should also give you a shout out. We know you're a big mentor to women as well. So thank you for all that you're doing for us here in the community. Again, always great to speak with you. Representative Brenda Carter, representing District 29. We always appreciate your time.
Thank you once again for having me anytime.
We're going to take a quick break here on the show, and when we come back, Detroit Alley Cats. What's that all about? This is the Oakland County Megacast.
COVID-19 has caused many families to fall behind on finances and on groceries. But you're not alone. You shouldn't have to worry about putting food on the table. My Bridges offers access to quality food and income assistance to help families across the state get the food support they need. It's easy to apply and easy to start shopping. Apply for services at michigan.gov/MIBridges. A message from the Michigan Department of Health and Human Services. Michigan, we're calling on you to save lives. Don't ignore it. Don't let it go to voicemail. It's urgent. In fact, it's critical. Because if you've been in close contact with someone who tests positive for COVID-19, you may have been exposed to the virus. And you could get a call from My COVID Help or your local health department. So please answer the call to learn how to protect yourself, your family, and friends. We're calling on you to stop the spread of COVID-19, to make it safe to reopen businesses and help Michigan move forward. So if you get a call from My COVID Help or your local health department, you may have been exposed to someone with COVID-19. To protect us all, answer the call. Learn more at michigan.gov/containcovid. A message from the Michigan Department of Health and Human Services.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Great to have you back with us here on the Friday edition of the Megacast, the 1-year anniversary this week here for this show.
Yes, it is. 1 year of the Megacast, and we are still in the pandemic, but we're going to continue to keep you informed because of that pandemic.
Well, just because we're in a pandemic, work does not stop, especially for people who are passionate about animals. We've had on the show so many times before some of our animal rescue friends, but usually we focus on dogs. Yes. I'm a dog person. Tyler's a cat person. So happy to find out more about this next organization. Dasha Zarina is with us now. She's the founder for the Detroit Alley Cats. Great to have you with us, Dasha.
Hi, great to be here. Thank you for having me.
Don't hate me if I'm a dog person.
Oh, no.
Dogs rule, cats drool.
My cats do drool, so that is in fact correct. They drool all over me.
Tyler and I both, well, we both have rescue animals. We know how important rescue animals are. Tell us more about your organization and how you guys got started.
So we are a cat rescue organization in Southwest Detroit, and we help the homeless and displaced cats in the city of Detroit by feeding them, fixing them, building them outdoor shelters, and finding them homes for the friendly cats and kittens.
How'd you get started in this?
So I moved to Southwest Detroit about 4 years ago, and I saw all these cats outside, and my partner and I were feeding them, and we knew that some of our neighbors were also feeding them, and that's kind of a regular thing around here. People just feed the outdoor cats. And we found 3 kittens in our backyard, and we managed to catch 2 of them, and the 3rd one ran off. So we took in these 2 kittens that were already kind of feral at this point, but we socialized them and we got them used to being indoors. And so these were our 2 kittens. And then a year later, I see the 3rd littermate. He's playing in the grass outside, and I go right up to him, and he's just the friendliest cat, and he just goes right up to me. And so we take him into, and he's actually nicer than the 2 cats that we had indoors, and he spent his whole life outside. So these were our 3 cats, Fluffy, Squishy, and Mellow. They were the original alley cats, and they inspired Detroit Alley Cats. So a little bit after that, we started our Detroit Alley Cat Instagram, where we were just posting pictures of the cats we were feeding, and we were fixing them at that point. And so that's what we were doing. And so there was this other cat, this other friendly community cat. We called him Zorro, and he was another friendly outdoor cat who was fed by various different neighbors. And family had actually tried taking him inside and adopting him, but he always was trying to go outside. So he just preferred living outdoors. So hi, this is Angel. She just jumped on my lap.
She's beautiful.
She is.
Thank you. She's one of our rescues.
That's okay. We like being pet bombed.
We do.
Yeah. So he was just this friendly outdoor cat. And so we just kind of let him hang out outside. We would play with him and feed him. And then one day it was Christmas 2019, and the family had taken him inside for Christmas and let him out after. And it was a few days after Christmas that we found him outside, and he was just barely alive, and he was at this point, he was pretty much gone. I mean, he was just choking, and his legs were paralyzed, and we just saw him like in horrible pain, just suffocating. And then he was pretty much gone. And so the way that he was suffocating was how animals suffocate from eating rat poison. And so rat poison kills small rodents pretty quickly, but when larger animals eat it, they die slowly and painfully. So what we did is we made a flyer for to pass around our neighborhood to warn people against using rat poison, and warning people that there was rat poison on the street, and that, people's pets could eat it and the outdoor cats could eat it, and just warning people against using it, because even if the rat gets poisoned, the cats can eat the rats and they would die. So we passed this flyer around our neighborhood, and we actually did get a phone call from the flyer from somebody who found rat poison. And so after that, we said, okay, we want to do more for these cats because they shouldn't be outside. We saw firsthand how dangerous it is for cats outside. And so after that, we really started connecting with other rescuers and finding cats who needed homes and finding people to foster them, and really trying to place these cats into homes. And then we have an adoption application on our website, and we have a screening process, so we don't just give out the cats. And then we started having a lot of people contacting us looking for cats, and sometimes we even have more people looking for cats than we have cats. So
that's a good problem to have.
Right.
Oh, yeah.
Right. So so that's our story, and we really try to place every friendly cat into a home.
So we are a year into the pandemic. What's it been like for you and some of your team members to continue this work in the middle of COVID-19 and the crisis? Have you found more and more people are willing to take in animals during this time?
Well, actually, we started our adoption process right as the pandemic hit. So I think that might have been why we have so many people looking for cats, and it's been a lot easier for us to find these cats homes. But we still continue our work. We get them fixed at the local clinic, and it's just a curbside visit, and we still do our trapping and our fixing, and it hasn't really affected our work too much, honestly. We still continue to feed them outside, and everything is through social media with us right now, and we've had pretty good luck, I guess, with that.
How are donations going?
So we've had great support whenever we have a vet bill, a big vet bill that we need covered. People are very supportive in donating to cover expenses like that. So that's been great. So we're really fortunate to have that channel for donations, and we never hesitate to take a cat to a vet at the first sign of anything wrong. So all of our cats are healthy thanks to our donors.
Dasha Zorina with us here on the Megacast. She's the founder for Detroit Alley Cats. If people want to learn more about your organization, where can they find that information?
So they can go on our website, DetroitAlleyCats.com, and our Instagram, Detroit Alley Cats, with a Z at the end instead of an S. And we have our information on our website and our donation links, and we sell merchandise, and we have a volunteer application, our adoption applications, and also a surrendered cat intake form.
So one of the things when you come across some of the cats out in the community when they're feral, what advice would you give to someone who comes across a feral cat and they are trying to maybe trap it? Is that a good idea or no?
Yeah, so we trap with a process called TNR. It stands for Trap, Neuter, Return, and that's where you use a special humane trap to trap the cat, and you fix it at a local clinic, and then you release it back where you found it. So that would be the main process for dealing with feral cats. We don't advise that people try to catch the cat themselves. You definitely don't want to get scratched or bitten by a feral cat. If people want any more information on TNR or how to get involved locally, they can definitely contact us on our website. We're happy to provide more information, but that is the main process of dealing with feral cats, and it's the most humane way of dealing with the feral cat population, and this would definitely be the main route to go for dealing with feral cats.
What other advice do you have to people that want to do something when they see an overpopulation of cats in their neighborhood? They want to do something, but they can't take them all in.
Right.
What advice do you give to them?
Well, you can definitely keep feeding them, and another thing you can do is you can build them shelters for when it gets cold that they can live in, and they can live pretty good lives outside in the winter, and as long as they have these shelters, they can live in those in the winter. And we actually have a shelter that we designed that we're releasing a manual for this month, and people can build their own shelters. and you can find online how to build these shelters out of coolers and just all kinds of stuff, and it's really easy. And so that's one thing you can do. But really, I mean, you really can just feed them and fix them, and that's the main thing.
So the spay and neutering program, how vital is that to help try to curb the overpopulation of pets?
So that's really important. I mean, like I said, it is the most humane way of controlling the population, and pregnancies are also really hard on cats. So it does make their lives a lot healthier to live outside after they've been fixed, and it definitely it helps all around. It helps reduce the population, helps make their lives healthier, and it's really the best way to go when dealing with the feral cat population.
So how many cats do you have now?
We lost count. I think we have 3 that are ours, and then I think 5 fosters right now.
Oh my goodness! Yeah, I bet you can walk through the neighborhood and name them all, though.
Yes.
Well, we so appreciate your time. Again, Dasha Zarina with us here on the Megacast. She's the founder for Detroit Alley Cats. If you can help them, please do so. You're doing such good work there in your neighborhood. We appreciate your time.
Thank you.
My husband has a limit on 1 dog right now. I'm trying to get Trixie a brother or sister, and he's like, no, 1 is enough.
Yeah, well, I mean, Trixie is multiple dogs worth of handling for one person anyway, with her energy, with her size. So I can see why Woody has that opinion. But yes, if you can adopt.
She has 3. You only have 2.
It's true. I can only have 2 in my place, so I wouldn't be able to do that. But I suggest it.
Well, thank you so much for taking time to be with us. This is going to wrap it up for the Friday edition of the Megacast.